Hello, my name is Jones Moon and today, we look at pulmonary tuberculosis. Pulmonary tuberculosis is a chronic infectious disease of the respiratory system affecting the lungs, in which there is formation of tubercles or granulomas in the lungs, which is caused by MYCOBACTERIUM tuberculosis, characterized by night sweats, dry or productive cough and fever. Normally, during inhalation, air enters the lungs by traveling down the trachea. Then it continues to the bronchi and bronchioles and ends up in the alveoli. The alveoli are tiny air sacs surrounded by small blood vessels called capillaries, and this is where gaseous exchange takes place. Tuberculosis is an airborne disease transmitted by respiratory droplets. When the mycobacterium gains access in susceptible condition, it will reach the alveoli in the lungs where it will multiply, invading the lung tissue and trigger an immune response via inflammation. The mycobacterium bacilli will then be ingested by macrophages normally found in the lungs, forming the classical tuberculous granuloma, which is a primary lesion. This usually remains small and commonly heals without becoming detectable. A GON complex is caused by Mycobacterium tuberculosis, which is the bacteria that causes TB. When the mycobacterium enters the lungs, macrophages recognize the mycobacterium as foreign and attempt to phagocytize them. Typically, a macrophage does this by engulfing the foreign material and packaging them into a structure called phagosome. The macrophage then fuses the phagosome with a lysosome, or organelle of the cell that contains enzymes that break down biochemical molecules. However, mycobacterium can produce a protein that inhibits this fusion, thereby allowing the mycobacterium to survive, proliferate, and create a localized infection called primary tuberculosis. Basically, the patient will have no signs, no symptoms of the disease, but will have a calcified spot seen on X-ray, and some immunoglobulins may be isolated or GON complex, which is a radiologically detectable finding characteristic of primary tuberculosis or TB. The lymphocytes will also be sensitized and in response will work together with the macrophages to surround and engulf the bacilli in the lungs. This acquired immunity usually inhibits further growth of the bacilli and further development of active infection. If the immunity is not strong and cannot handle the bacilli, the infection tends to be aggressive. The bacilli may spread from the lungs via the bloodstream or lymphatic system to other parts or organs of the body, including the meninges, bones, liver, kidneys, etc. Other than that, necrosis of lung tissue occurs, producing a caseous cheesy substance composed of bacteria, pus and mucus. This is coughed up as sputum, leaving a cavity in the lung. If cavities erode the blood vessels, the patient will cough up blood. When healing occurs, there will be much scar tissue. Thanks for listening and keep studying.